Before COVID hit, we know that violence against women is extremely common. It happens to 1 out of every 3 women in her lifetime. What we see unfolding right now is that domestic violence is really increasing because of all the strains related to safety, health, increased strains because of money worries and confined living conditions. So for some families, it's a really toxic mix of stress, of vulnerability. And we know that domestic violence is really about power and control, right, at the heart of it. And so people are trying to reassert that power and control. There's very frightening statistics coming out of countries worldwide. We're seeing, in some cases, tripling of cases, and those are staggering numbers. And so we're seeing women's rights activists, even government, flagging that this is a really serious problem. Service providers are having to be creative about how they get information to women. Women are having to be creative about how they seek support. In some places, women are going to pharmacies, right? The places people can go are grocery stores and pharmacies in most countries. And so they're setting up little pop-up crisis centers in grocery stores and in pharmacies to be able to respond to women's needs. Texts are becoming more and more important. So services are now reaching women in different ways through WhatsApp and through other types of, SMS messaging. And also neighbors and families are having to say, look, can I help? What we realize is really critical in this moment is making sure that women know which services are still working, because it's true that not all services are still working. And so we're working very closely with partners on the ground, frontline service providers, shelters, hotlines, police, health, all of these networks of supporters to identify who's still available and put that information right into the public view. And making sure that governments are not losing sight of this life-threatening issue, even during COVID, right? In a lot of countries, we're hearing that some women are going to hospitals or police stations and they're being told, not right now, please come back after COVID. And so we have to really be clear that we have to keep the focus on this issue right now, even during COVID. First, learn about domestic violence, understand what it is, understand some of the dynamics of violence that you might see unfolding in the lives of people that you know, and then understand what kind of supports people need when they're in that type of situation. If you see that violence is happening and someone's in danger, it's important to call the police. You can call the police. You can take action. And then finally, what I will add, if you want to show your support, you can donate your funds to support UN Women. You can support women's organizations like UN Women that are local. We partner with local organizations and frontline service providers like police, justice, health workers, social workers, and helplines across the world. And so we all have a role to play, right? It really is us being a village and supporting each other and communicating shared values at a moment like this.